So I guess on that note, as we're rounding out the hour, let's talk about how the rest of 2020, right? So, obviously there's a lot going on, but, where do each of you see the rest of 2020 going, both from, I guess, momentum and funding, right? I mean, at the end of the day, obviously there's a lot of money thrown towards this, but what's your guys' prediction? What do you see happening for the rest of this year and going into 2021, both from the energy and momentum behind both on the healthcare side, nonprofit side, service provider side, as well as the funding?
Well, in Colorado, we've been using the expression "never let a good crisis go to waste." And I think we hear quite a lot in public health. But in that sense, broadband is definitely top of mind. And so in Colorado, at least, what's exciting is that we're seeing a ton of alignment across most of our state agencies and departments, which if you've ever worked in government at all, is not always the case. So that's been pretty cool to see, and just a lot of consensus around that. We're also seeing that our legislators are really advocating for that much more vocally at the federal level, because much of this is determined at the federal level with the FCC and other groups too that have influence, like the Office of the National Coordinator for Health IT that can support, and HRSA is a big voice in that conversation as well, Health and Human Services. So that's been nice to see. And then again, talking about foundations, and it's pretty cool. We actually have Bruce Byington as one of our attendees on this call, who's the Chief Innovation Officer for the Colorado Health Foundation. And so they have been, again, mapping broadband and leveraging their resources and their pull, since they work across a number of sectors, as well as with, pretty much all the foundations in the state, to look at how can we work together to address this in communities to advance equity. And then the nice thing too about a funding strategy that we've seen work well in Colorado is this concept of federal matching dollars. And that's one of the places where the state has been really clever in pulling in resources, and where the foundations have been really useful too. And that typically, if you can show that you have a certain pool of funding, right now we have a 90-10 federal matching. So if we can pony up 10% of the funding and show that we have that, then we can get a 90% match, which is huge, right? That takes us from $100,000 to $1 million. And so there's a lot of those initiatives happening. And then the other place that we're seeing a lot of really good work at, so kind of going back to the foundation and how we can use dollars, is seeing foundations partnering with investment groups. And so when we're thinking about how do we raise the capital needed for innovation, partnerships between foundations and investment groups to leverage those different resources and make that case of, hey, invest your money here in this thing that's important to us, and we'll support that funding. And then, all of that works really nicely, especially then when we look at that coordination with state funding approaches for federal matching dollars. And so I think the more that you can see this kind of collaboration, and again, to that point of these different sectors, there are really amazing foundations that focus on education, really amazing organizations, both in the investment community and in the nonprofit community, that focus on economic development. I think smart cities is an exciting opportunity and place for more innovation in terms of how that's been working. And Microsoft has partnered in that Smart Cities Alliance in terms of how do we look at designing communities that do have nice ubiquitous Wi-Fi access and technology wired in. So yeah, we see James on here, people using the Microsoft donating access points. So I think that there are a lot of interesting things there in terms of all of these different public-private partnerships, and really leaning on
that. There's a renewed kind of imperative and momentum towards investing in connectivity infrastructure from the federal level too, and a lot of people in our space are gearing up for this Rural Digital Opportunity Fund, RDOF auction, $20 billion going out to sort of facilitate or subsidize unserved and underserved area build out and connectivity. And you know, in the scheme of things, it is expensive, but as infrastructure goes, it's not that expensive. I mean, we've got towns here in our area that have built fiber to the home for, let's say, $3 million, you know, for a whole project. Maybe a bigger town might be 10, it could get bigger than that, but these are, you know, smaller towns that are doing ubiquitous or complete connections, as you mentioned, Brian, to everybody, fiber to the home. And then you've got, you know, on the healthcare side, the spending is just, you know, add some zeros. You got a hospital putting $300 million into, you know, a building upgrade that could fund whatever, you know, 50 small town fiber to the home projects. So even in the healthcare economy, there's so much room for cost savings, really. They can claw back some of that somehow and put it into broadband.
You know, one other thing, heck yeah, by the way, on cost savings and demonstrating how it reduces costs in healthcare, I think that's huge. The other thing I was going to add after listening to you, Will, was this is also a really good place for citizen action, right? When we think about areas where people could get involved and really mobilize in local communities, you have a lot of leverage at the local community level to say what you want your internet connectivity to be like in your community and to organize around that. And local communities, whether it's a city, a county, a municipality, a region, a state, they have quite a lot of power and agency in terms of advocating for that. And so I think something we haven't really talked about yet is the role of the public in terms of saying, we want this, we want to have a vote on this, we're willing to add an extra 10 cents in taxes a year if it means we all get free, awesome Wi-Fi. And there are also a lot of other things that we can do around access to technology and devices, which was something we were talking about earlier. And there are a lot of really interesting models about that. But I think we need more people having a fit about the state of broadband in America. It's pretty.
You ready to fire some people up? Light a fire?
Yeah.
You want to pull a 6-pack of something? Is that what you're trying?
Where's my tequila? Give me a megaphone and
get yourself fired up.
Well, I mean, yeah.
But Rachel's making the same point I made earlier. The people with the loudest voice bring attention to a matter, but then when something's partially solved, those louder voices go away. We just need to we need to keep being loud.
Yeah.
Everybody does.
So what's that? So we're about out of time here, guys. And obviously we could talk about this. I mean, I think we've talked about having multiple discussions in this space. But I guess to close, I mean, you know, Rachel, you talked about a lot of different points, and Sue, you did too, as far as education and knowledge. But, you know, obviously we are in a pandemic, right? We're in a situation where the mind share is tough. People are, you know, unemployment is sky high. People are stressed. Obviously mental health is an issue. So in a situation like this, how do you, if you had one thing each of you would tell, like, you know, what do you, to get to that goal of, you know, education, getting to, you know, bridging the digital divide and trying to bridge the inequity, what's the one thing, not 10 things, what's the one thing you would want people to try to take away and to do? Because obviously there's only so much mind share you can have, right? And people just don't have the mental capacity to keep doing everything. It's like, that old saying, can't eat the elephant all at once. You can only, you know, start at the tail or, you know, go from there. So what would be that one thing each of you would want everybody that's listening, and as we distribute this out, what do you want them to take away?
Well, I think for me, the biggest thing is really carrying on from what Rachel's saying. You as a consumer have an amazing voice right now, bigger than you've ever had. And it is a right, it should be a basic right for all citizens of our country to have broadband, and adequate broadband for not only telehealth, but all the different things we've talked about today. So, you know, don't let a good crisis go to waste.
Mhm.
I agree. I think with this crisis, I mean, I've wanted healthcare to redesign itself for a long time, and now is the time for virtual to be the default, for virtual to be the care for people with mental health conditions and cancer and, you know, problems, you know, going face to face. That should be the default. So it needs to be flipped on its head, but the system has to make sure that that it doesn't perpetuate disparities. There have to be mitigations where people can get help getting that access and not just dependent on, you know, having versus not having.
Absolutely.
Awesome. Brian, any last words? I think to add to that?
I love how this evolved into raise your voice, speak out, get involved in the community, stuff like that. You won't affect change unless you're involved. You have to be involved. So I love that concept. I think that's a good takeaway for me, for sure.